in a safe and effective way because we're preserving critical anatomy, which preserves sexual function, and continence, which is very important to patients while having a lot of their tissue removed. And that is all done through ultrasound guided imaging. So this is probably the most important part that we need surgery day. In regards on how to process them is more or less simple, but there's a few key factors that we need to make sure we don't do because the probe can break. First thing we want you to do in decontam when you get it is do a leak test. The leak test, we have a leak tester here. We're going to do a dry test and a wet test. It's going to come to you from the OR with the cap on. It could be sprayed, it could not be sprayed, but the cap should be on when it gets to you. Go ahead and take the cap off all the way. It's just a screw cap. And we're going to do the pressure test. Now for the pressure test, we do 2 steps. Like I said, the dry and the wet. We are going to blow up the pressure to 150, plus or minus 5. If you blow it up to 160, it's going to lose pressure faster and it's going to look like a fail. It's not a fail. Just get it as close to 150 as you can and then start watching. For the dry test, we are going to watch for about 45 seconds. It can lose up to 10 psi. Up to 10, still a pass. For the wet test, we're going to do the same thing. We're going to reduce it, blow it back up to 150, put it under water. We're going to watch for about 45 seconds. So we pump it up, take it to that 150 marker, which is right in the middle, and just watch it. Most of the time, it's just going to stay in the same place. So that's okay. When you do the wet test, make sure that there's no bubbles coming out of the cap. If there's bubbles coming out, it is an instant fail. Any questions on the leak test?
Do we take off that other cap?
This cap will stay tethered on.
Okay, that's what I
Stays
haven't
tethered
done.
on just because when we do our next step, when we start reprocessing it, which is going to be hand washing it. Hand washing it, you'll do your normal hand wash, enzymatic detergent, soft bristle brush, clean everything off. Make sure when you're doing this hand wash and you submerge it, you put the cap that's on the tether back on. There's a lot of technology that goes into this, and like I said, if these ultrasound probes break, we can't do the procedure at all. So make sure when you start hand washing it, cap goes all the way on, and you screw the cap all the way tight. Now that's just for the hand wash. When we're going through the V-Pro, we want to take the cap off. If this cap is all the way on and goes through V-Pro, what's going to happen is, this is going to look like a goldfish. It's going to pop. Won't fit in the machine, won't work anymore. So make sure when we put it through the V-Pro, we take the cap off. And just make sure it's not wet on the inside or around it. Just wipe it down with a towel and put it through the V-Pro. But cap off for V-Pro, cap on for hand wash. I cannot emphasize that enough. I think it's all built into the directions.
Yeah. So everything is in SensaTrack as pop-ups. Please make sure we are following the pop-ups. I'm working on putting it as a pop-up on quality as well. I just have to figure out what area I need to input that information in. But I'll connect with SensaTrack. They'll walk me through how to do that for quality. All right, but when you're on assembly, it will pop up.
What if it comes back from the OR, not with the cap and sprayed in it?
So when that happens, we're gonna immediately escalate our point of use and let people know in the room that the cap has to be on because they shouldn't be spraying inside of that component. However, we are gonna do the best of our ability
Will it
to
damage
gently wipe, it probably will. We're gonna do the best of our ability to gently wipe away any of that spray. When I say wipe, it does not mean a wet wipe. You will take a dry towel, wipe out as much of that excess, and then go forward with your testing. So once you test, if it did affect anything, any of those components on the inside, it will fail the test. And then we will take it out of service either way.
Yeah, and just make sure you're documenting when you do the tests. It's the most important thing. It's the first thing. If something does go wrong, something breaks, my company, the Bears of Bad News, are going to ask you, when was the last time you did a leak test? I've seen it all too often where people aren't documenting their leak test, and like, we don't have any documentation for you. Company tells you to kick rocks. I wish it was a better way, but sometimes I have to be the Bear of Bad News.
So we're gonna have like a
Do we
sign.
document?
Yes, so there is going to be a new process. Just like quality, there will be a barcode on the hand wash computer that you're going to scan. It's going to ask you to input some information. The leak test is going to say pass or fail. It's going to ask you date and time. And then it may ask you what number probe that you guys got. So make sure when you are hand washing that you're also scanning those containers and you're keeping the hand wash stuff in the container. That way we know it's ultrasound probe number 1. Because I was going to put the serial number, but I don't want you guys to have to type out 5 million numbers.
It's a pretty long serial
It's a
number.
long serial
so-
number.
Any questions?
Can you show us the pressure?
Yeah. Okay. What was your question?
What's the name of the procedure?
It's called aquablation. So aqua, then ablation, so like ablation, but you add aqua in it. So it's a very fun procedure. It's about 30 to 45 minutes. It goes quick for those patients, no matter shape or size prostate, because we're playing to that patient's anatomy. So whatever we see when we put in with the ultrasound, we're treating. Sorry?
Yep.
Yeah. So for the test, cap goes all the way on, just make sure it's screwed all the way on. You don't have to crank it to be all the way tight, you'll know when you get there, because you'll just hit like a wall. This tester doesn't like my demo hand, this is my demo hand piece, so it's okay if it's broken. Pump it up, just make sure it's all the way tight. Pump it up to 150. And I got it right on the dot, it's sitting there. Just wait 45 seconds.
And then what he was saying is even after the 45 seconds, if it drops 10 PSI from my understanding, that is still passable, correct?
Up to 10.
Up to 10.
Over 10,
Okay.
fail. But I will say, if it does fail, call us. 'Cause
I was gonna say, what's the next step?
I'm gonna come in, test it myself, make sure that it is an actual fail, because I've had it before where it's like, it's not really a fail. But it's just because, 150 PSI is a lot of pressure just for the cap, so.
After how many uses is it like failing? Or should it?
It should. If it does, it's probably the seal on this. We'll get you a new one. Yeah. This looks pretty good.
And
Mine's
then,
passes.
just to give you guys an idea, normal TURPs take about 4 hours. So with this procedure, it's about 45 minutes. So that drastically is gonna cut the case time. So just keep that in mind when we're reprocessing. These items shouldn't take 3 to 4 hours to reprocess, and they're gonna be doing a lot of these cases. So it's gonna move quick. We got 4 probes currently in our inventory. We are looking to increase, depending on the volume, but we started with 4. So when you guys see them, please expedite them.
And our first case is on the 18th, right?
Tuesday.
Tuesday.
We got 2 of them?
3.
3.
3 cases.
They're
on Tuesday.
scheduled.
So just be ready. I'll pop by, just make sure everyone's good to go. I'll be hanging out all day. So any questions, my phone number's, I have a lot of people on my phone number. I'll be easy to see. They have us wearing red caps anyway, so we're easy to call out. So any more questions? Qualms, concerns?
All of the new ultrasound probes are in decontam, so they will need to be processed. I'm gonna print out that barcode for the leak test, and I'm gonna put it on there. If you guys need help walking it through, at least inputting the information, please let me know before I leave.
Is the leak tester in there too?
This
We're
is
gonna
the
put it
number
in there
right
right
Yeah. Yeah, cool.
Thank you.
No worries.